Hello, everyone. Good morning. Thank you so much for coming, and welcome to Lev Aaron Biker Holem's program on mental health, part one. This is, we hope, the first Amrit Hashem of a number of programs to speak about real solutions for mental health. We are looking for the root causes, not just to put a band-aid, and looking to make people healthier in their whole self, because we know that the mind and the body are completely connected. And when people are healthy in their body, they're healthy in their mind. When people are healthy in their mind, they're healthy in their body. I want to let you know that this program, the recording will be Amrit Hashem on my hotline. The number is 929-277-2700, 929-277-2700. And you can also obtain the video. Just ask me to send it to you. Questions are welcome. Please ask questions. Please put them in the chat box. The questions will only go to Mr. Steinmetz and myself, and he is going to try to answer them as much as possible at the end of his talk. So this is a two-part talk. First, Mr. Steinmetz is talking about some specific modality out of several modalities that he's found to be very successful, and then we are talking about other root causes for mental health afterwards. So Chaim Moshe Steinmetz is a LISW, is a therapist in private practice, and Chaim works with clients facing trauma, addictions, anxiety, relationship and marital issues, stress, and more. And his mission is to help clients find the healing and resolution that they seek at the deepest level and as quickly as possible. And he says that while talk therapy can be helpful on its own, it's often not enough, and it can be slow and painful and at times inefficient. And to that end, Chaim is trained and continues to train in many therapeutic modalities beyond talk therapy that integrate a whole person perspective. And these include EMDR and Sedona method, trauma-informed stabilization method, and more. So right now he's going to talk about something called amino acid therapy. And his philosophy is what, which we just described, is what led Chaim to research and train in amino acid therapy. And this is a really, really fast. I was very excited to hear about from him. We discussed it at length, and he's going to tell you about it today. So, Mr. Steinmetz, can you tell us what is amino acid therapy?
Yes, thank you for having me. So I'll just summarize what it is, then we'll get into all the details as we move along. So the summary of what it is, we use amino acids, which there are many. There's about 10 different amino acids. Sorry, one second. There's about 10 different amino acids that are used in amino acid therapy for mental health. There are more than that overall, but we're using specific targeted amino acids to raise depleted neurotransmitter levels. Neurotransmitters are they're called chemical messengers, but what they are, they're chemicals in the brain that govern every aspect of mental health and some aspects of physical health as well. So in order for us to function at all, we need to have neurotransmitters. If our neurotransmitter levels are good, they're adequate levels, then we function well. If they're not functioning, sorry, is there any way to move? Because I'm looking at myself instead of looking at anybody else. I took it off. Got it. If our neurotransmitter levels are adequate, then we function well. If they're low, then we have all sorts of problems. There's four different neurotransmitter systems that we target in amino acid therapy. They're serotonin, dopamine, endorphins, and GABA. Now, those are commonly used in psychiatry. Now, there's a lot of the psychiatric medications that are used target those neurotransmitters. Amino acid therapy is doing it using amino acids. Now, amino acids are naturally the way the brain produces neurotransmitters. Food that we have, like a regular healthy diet, contains a certain amount of amino acids. So protein has many different amino acids, and that's the way the brain naturally produces it. If you have a steak, there's multiple amino acids in the steak, chicken, eggs, fish, and the brain uses that to produce the neurotransmitters. But if your neurotransmitters are low, then there's nowhere near enough in your diet to supply that for many reasons. Just the diet is also a little bit of an inefficient way of getting it because there's competition um, if in the brain for the absorption. I don't want to get into too much detail because it's pretty boring and it's not so relevant. But the main thing is that the diet can supply it if everything is going smoothly. But there's many reasons why the diet is insufficient, especially if your neurotransmitters are already low. In those situations, amino acid therapy, the goal of it is to restore your neurotransmitter levels very quickly and effectively, using the specific amino acids that are necessary for the neurotransmitters that are low. So there's 10 different amino acids that we use. Each one is targeting a very specific neurotransmitter. So depending on what your symptoms are, what's going on in your history, that's going to determine which ones you need and the dosages and all that. That's basically it. Is there any questions so far on anything that I've said?
Um, well, I remember that we discussed, and I wanted to actually say this in the beginning. The limitations, we're not going to be really getting into acute mental health disorders today, although the foundation is the same, that it's a whole body health issue. It's a metabolic issue, a deficiency in the mitochondria, and it's something that can be tremendously helped with physical health, biological health interventions, but we're not really going into acute mental health disorders so much today. So I know that you mentioned that that's not, the acute mental health disorders are not something that you work with, but what
Well,
can amino acid therapy treat effectively?
yeah. Okay. So I guess there's different understandings of acute. It depends on what we mean. So the things that I don't treat with amino acid therapy is psychosis, bipolar, or a history of mania, more that end. Now, there's different, that definitely is acute, but there are certain types of acute mental health issues that could be treated. Depends what,
Oh,
again, everybody depends on what terms we're using for acute.
okay.
So when the acute things that would not be indicated for amino acid therapy is psychosis, like schizophrenia, bipolar, mania, or suicidality.
Hmm.
Some practitioners will do that, but I don't use amino acid therapy for that.
Hmm.
Um, so what conditions? So there's a lot of different things that we can treat using amino acid therapy. And the reason why you can treat so many things, a very broad variety of stuff, is because amino acid therapy is really a broad spectrum. It's not like one pill for a condition. It's 10 different amino acids that are all targeting different neurotransmitters. So because there's it's really a system more than a specific pill. It's a system of treatment, and that system can address lots of different things because these amino acids address different neurotransmitters. So some of the things that I do with amino acid therapy is like a lot of the very common issues that come up. So anxiety, it's very effective. Again, I just want to say I recently started offering this. I recently got trained, and so I'm coming from what I've been trained in, and then my own experience corroborates that. But there's a lot more that needs to be learned, and Mr. Shem, I hope to learn a lot more about it as I go along. So I'm well trained in it, but the experiences that I'm discussing from my own practice are coming from the last few months. So they shouldn't be they're real, but I don't think there's one method that works for everybody. I see that in my practice with every method. That's why there's a need for many different modalities. So anxiety is very common and it's treated very well with amino acid therapy. There's also a lot of different types of anxiety. So all the different types of anxiety can be treated with amino acid therapy. Worry, phobias, self-doubt, perfectionism. These are all different shades of an anxious tendency. They're all social anxiety as well. It's very effective for social anxiety. Overthinking, ruminating, um, that's for anxiety. Depression. Now, in amino acid therapy, there's different types of depression. Psychiatric model doesn't usually differentiate between the different, I'll say, flavors of depression. But in amino acid therapy, there's really three types of depression. There's negativity, like a doom and gloom type of mindset. Then there's apathy or lack of motivation, which is blah, which is a completely different neurotransmitter. And then there's a third type where there's like a very deep pain, sadness, grief, hurt, um, which is a third type. Now, they're all called depression, but from the amino acid therapy perspective, they each have a very different cause and they're treated differently, which is why sometimes it can be helpful for somebody who has not gotten benefit from medication because medication is targeting one specific neurotransmitter, not necessarily the one that the person is low in. So depression, addictions is a very big, there's actually drug rehabs that use amino acid therapy for treatment because all addiction addiction is complex, but there's a few components. There's a psychological component, but there's also a biochemical component. Any addiction, whether it's to a substance or to a behavior, it releases neurotransmitters. So let's say an alcoholic, when the person drinks alcohol, it releases all the neurotransmitters, dopamine, GABA, endorphins, serotonin. And if the person's low, that's part of what draws them back to the addiction. Part of it is psychological. Part of it is that their brain is low in the neurotransmitters, and the craving helps the brain experience the neurotransmitters they need. The problem is, besides all the mess that addiction causes in people's lives, the problem is that actually it doesn't restore the levels. It actually just squeezes out whatever little left the person has. So they feel it because they got a release of the neurotransmitters, but it actually makes the problem worse because now they're getting more and more depleted by squeezing out whatever little neurotransmitters are left. So amino acid therapy is used to replenish the neurotransmitters so that the cravings and the urges are they're either gone or they're much lower. There's still the psychological component that needs to be addressed, but it's extremely effective for addictions. And within that realm, I want to there's another big topic within that, SSRIs. So before I say this, I just want to say I'm not at all condoning that anybody should examine their SSRI. If it's working and they're happy with it, they should stay on it. But there's many people who either it's not effective for, doesn't work, or they have a lot of side effects that are intolerable. So in those cases, amino acid therapy can be very helpful. And I and other amino acid therapy practitioners can work together with the person's doctor or psychiatrist to help them get off of an SSRI if it's not it's too high. I'm sorry, if it's not helpful for them because it just doesn't work for whatever they're struggling with, or the side effects are too high and they want an alternative. I would call that within the realm of addiction because it's still depleted neurotransmitters and the person's dependent on the medication, but it's not really working, but it's hard to get off of it. So it could help with withdrawal. It can also help with the core issue that the person is looking to the SSRI to treat. Then there's trauma. Now, trauma is very interesting because trauma is not caused by depleted neurotransmitters. Obviously, it's caused by something that happened, but the effects of trauma can deplete neurotransmitters because anytime there's chronic stress, there's a release of stress chemistry, fight or flight. It's called fight or flight, which is there's hormones and neurotransmitters that are released that run down the system. And it's a very significant part of the symptoms of trauma. So amino acid therapy is not going to get rid of what happened, and the person will still need to work through that, but everything can go a lot quicker because the neurochemical aspect, it can be restored with amino acid therapy. And a lot of the symptoms are actually related to the chemical aspect of the trauma. Now, the trauma that happened, but then the effects on the body because of the way the brain processes it, that can be very helpful for insomnia. It's I've seen, Baruch Hashem, very good results with insomnia. And the reason for that is because insomnia, well, for a lot of people, there's a lot of stress, either physical tension in their body or overthinking. They can't turn their mind off. And amino acid therapy is very useful for that. So it's very effective for insomnia. Relationship issues, it's not going to solve whatever's happening in the relationship, but very often it doesn't, there's a lot of the problem is that the neurotransmitters are low, so they're getting defensive or they're getting triggered easily. And even if you work really hard on yourself, if the body and the feeling is still there, that makes it very difficult to implement whatever skills the person has. So amino acid therapy can be very helpful for that. I just had a client recently. I wasn't sure if I should say this because I don't want to mischaracterize it, but I had a client recently. I was seeing him for a while, and then we started amino acid therapy. He came back a couple of days later, and he told me His wife told him this is the first time she ever felt safe with him since they're married. And it was a couple of days after he started amino acid therapy. So, I got Baruch Hashem, there's a few results like that. I want to be cautious because I don't know that that's going to apply to everybody, but I've seen enough and from my training that it could be a very helpful tool for a lot of people, I hope. Um, ADHD is another one that it's very helpful for. And the way it works with ADHD is a little bit different than meds because we're addressing all the different components of ADHD. So there's the focus and distractibility, which is one neurotransmitter symptom. Then there's very commonly a lot of anxiety or overthinking, which is a whole nother neurotransmitter symptom. And then very often people with ADHD have a higher level of sensitivity for good and for bad. And those they're more creative, but they also can find emotions can feel more intense. So that's another neurotransmitter symptom. So it's a much more holistic model than the medication route for ADHD. When we go further along, we'll get into the pros and cons because there's a lot of pros to it, but there's also some cons to amino acid therapy versus medication. But it's very effective for a lot of the neurochemical aspects of ADHD. Um, Weight loss. So amino acid therapy will not make you lose weight if you have a slow metabolism. But what it is very helpful for is overeating or cravings, especially if it's like late in the afternoon or evening cravings, because those have a very specific neurotransmitter cause. So a lot of times if somebody wants to go on a diet and they find themselves cheating on the diet all the time, the reason for that, excuse me, is because their neurotransmitters are low and food, especially sugar, white flour, all really trigger release of many different neurotransmitters. And because the person is low, that's why they're finding the cravings irresistible. When you replace them, amino acid therapy makes it that yet you still have to stay in your diet, but it's much easier because your cravings have subsided because your neurotransmitters are balanced. So it's easier, or for a lot of people, it's actually almost effortless to stick to your diet and to not overeat. Um, Overall, emotional pain and regulation, emotional regulation, emotional pain is very difficult for a lot of people. Let's say sadness, loneliness, hurt. That's actually a very interesting category for amino acid therapy because there's no medication that treats that. Medications can numb it. So let's say SSRIs can be very helpful for calming down the system overall. But it's not targeting emotional pain specifically. Now, within the amino acid therapy department, there's specific amino acids that can be used that we don't have a medication parallel for. That, let's say, for example, endorphins. Endorphins is the feel-good neurotransmitter. We don't have medications that target endorphins for the most part. There's a few, but most of them are work very differently. They don't actually feel good. But in the amino acid model, there are specific amino acids that raise endorphin levels. A lot of grief, pain, emotional pain, sadness, loneliness, part of it could be life circumstances, but it can be a lot better when the brain is producing naturally what it needs to feel good inside your body. So raising your endorphin levels, depending on the person, again, is very specific, could be very helpful for emotional pain. That's a broad umbrella of different feelings, but it could be very helpful for that as well. I think I covered most of it. Yeah, I covered at least most of what I do with amino acid therapy.
Mm.
Um, is there any questions on that from you or from
Uh,
any?
yes, I mean, what about OCD? I remember we were discussing it, and
Yes.
yeah.
So I treat OCD in my practice. Now, amino acid therapy could be a very helpful tool, but on its own, it's not usually going to resolve it completely. It can be very helpful. It can like lower the flame, so to speak. But if it's full-blown OCD, it usually will need therapy along with that. There are very specific types of therapy. ERP, we talked about that a little bit, but exposure response prevention is the gold standard for OCD. It's very effective. It's not so easy, but it's very effective. I also use some other models along with it. So amino acid therapy, I would say, is sort of a supportive treatment versus being the entirety. I guess, I mean, in all of them, it's not the entirety. Sometimes the person will have like a complete, like their symptoms will be gone with amino acid therapy. But for a lot, it's a very, very significant reduction, so that quality of life is improved, and you feel better, you feel more confident, more happier. But it doesn't mean it's 100% gone. So for OCD, I would say it's a little bit less than the other things, but it can still be a very helpful tool
Mhm.
alongside other tools that I use in my practice.
Are you comfortable mentioning the supplements that you use to help OCD?
Yeah, so there's a lot of different stuff. In amino acid therapy, I don't want to comment on the specific amino acids because those have contraindications, and I don't want anybody to, if they're on an SSRI or have other conditions, they can actually be a problem. But there are some that I use that are fine regardless of what's going on. I think a person should look out for themselves. But inositol is a B vitamin that in high doses, there's actually studies on it, and I know that there's psychiatrists who are using that as a helpful tool. It's a, there's different dosages. I think some psychiatrists will use up to 18 grams a day, which is a lot. Not 18 milligrams, 18 grams. So I use inositol. Um, NAC, which is an antioxidant, is there's research that is helpful, so I'll use that along with the specific amino acids that can be helpful for OCD. And there can be a few. There's usually it's serotonin, depending on the specifics of the person and their symptoms. Usually it's serotonin related. So then we'll take amino acids that are helpful for raising serotonin along with the inositol and the others, and that can make it a lot better. And that will make therapy go a lot quicker, a lot easier. Then there could be, a lot of healing with that route.
It's so amazing.
So
What are the benefits of amino acid therapy over other approaches?
yeah, so there's a bunch of benefits. I want to there's like I would say one con that I see versus there's one downside and there's a lot of benefits. The main Sorry, you're muted. There you are.
I was saying bar nefashos. I'm sorry.
Oh, yeah, okay. So you were talking. So I would say that the most important distinction between amino acid as a model and medication is that medications don't actually address the root cause. For example, SSRIs. So SSRI is a selective serotonin reuptake inhibitor. What that means is that it doesn't give you more serotonin. What it does is that it blocks what's called the reuptake or the reabsorption of serotonin, because serotonin is absorbed back into the cells and then comes right and then it goes back out into the synapse. That's, we'll have to get into the technical terms, but it makes it that your brain has more availability of the serotonin that you have, but it doesn't give you more of it. So as soon as you get off of the medication, you go right back to your symptoms. And also, even when you're on it, if you don't have enough serotonin, let's say, just as an example, this is a very crude analogy, but let's say you need a cup of serotonin in order to function well. Now, if you only have an eighth of a cup, so the SSRI is going to take that eighth of a cup and make it much more available to you. You still only have an eighth of a cup. So your symptoms may not get better, besides for the fact that if you go off of it, you return. But what the big distinction between amino acid therapy and psychiatric medications is amino acids is addressing the root. It's giving you more of the neurotransmitter. So if you're low in the neurotransmitter, what you're doing is you're just having more of it. Because of that, there's a lot of benefits to that. I think all of the different benefits that it has stems from that point. It's actually addressing the root cause. It's giving you more of what your brain naturally needs. So because of that, it's effective immediately. I shouldn't for people that it's effective for. And the statistics and what I see in my practice is that it's about 80%. 80% of people get a very significant benefit from amino acid therapy, but it works immediately. The first day, the first time you take your dose, you notice exactly what it's going to do for you. Whereas a lot of medications takes weeks until you start seeing a benefit. Um, that's one. For a lot of people, they can get off of amino acid therapy because since we're addressing the root and you're raising neurotransmitter levels after a certain amount of time being on it, your neurotransmitter levels may be replenished, and then you can maintain it using a healthy diet. So that's another very significant benefit.
How is it that it's something that's it's like a fat soluble vitamin that how is it that it replenishes and then it stays replenished?
So it doesn't, no, it's it doesn't stay replenished from what you took. If let's say your engine is low, so
Yeah.
your brain is constantly depleted. Once it's up and
Uh-huh.
running, maintenance, you always need amino acids. No, you're not relying on the amino acids that you took 6 months ago. You always need amino
Uh-huh.
acids. But if you have a healthy diet, you're getting amino acids. The problem is that you're way too low, so the amino acids is not getting you back up to where you need to be. It's enough
Mm,
to maintain baseline healthy levels.
mm,
But if you're depleted, so let's say you need from 1 to 100, we need, again, I'm just using the number 100 milligrams. This is just points that I've had. We don't have these numbers. So amino acid therapy will maintain 100 if you're at 100. If you're at a 2, it's not getting you nowhere near that. The levels in your food are nowhere near enough to treat a mental health problem. They're
mm,
enough to maintain a healthy neurotransmitter system.
mm,
So
mm,
that's why for a lot of people you could get off. Not everybody can. And I think it's important. There's many reasons why there can be depleted neurotransmitters. So it really
mm,
depends on the reason.
mm.
Um,
You mentioned stress is
right,
something else.
exactly, exactly. So let's say stress and trauma, I'm going to put that in the same category because those are the most common problems that people have, and that's irrelevant to whether or not you can get off. So if you have chronic stress or even short-term stress, you're depleting your neurotransmitters. If you take the right amino acids for what's going on for you, you can get back off, to your levels that you need to be, and
Mhm,
then maintain it with a healthy lifestyle. Now, you still have to do some stress reduction things because that itself supports neurotransmitters and a healthy diet.
mhm, mhm,
Trauma also. But let's say somebody has a genetic issue. I don't mean a big, scary genetic issue. A lot of mental health things can have a genetic tendency. Somebody who's by nature very anxious, a lot of that could be that it's an inborn genetic tendency, which by definition means there's a tendency towards low neurotransmitter levels. So that person may not be able to get off of it. They can go much lower, or they can do it intermittently. And it's extremely individualized. So, there's no way to say a one size fits all approach. It depends on the person and it depends on the cause. Diet is also very relevant because if their diet is the issue, and then that very likely can be rectified. You go on the amino acids till you get back on track, and then you can slowly get off of them as long as your diet is healthy. But if you want to keep eating unhealthy, you could, and then you'll just have to take your amino acids. I mean, I don't recommend, eating NASH all the time, but the amino acids will work, but you're going to have to stay on them longer because you're not really addressing the source of the depletion. Um,
mm. I want to stick in something about diet because a lot of people think that, meat isn't healthy and, eggs aren't healthy and whatever.
yeah,
Now, now the truth is coming out, with the new, now there's new dietary recommendations. But for so long, people were eating high carbohydrate diets and especially refined high carbohydrate diets on top of that. And it just makes it so much worse. And there is a lot of um, information about, there's studies actually about ketogenic diets actually reversing, even, very, very serious mental health issues.
yes,
So
I read about that. It's fascinating.
yeah, yeah. So everyone should, should know that yes, you need to eat meat, you need to eat eggs, you need the butter, you need the saturated animal fat for your brain to work properly.
What you're raising is also, it's very important for amino acid therapy also because the first, the most important foundation is blood sugar. Because when your blood sugar is low, and there's many reasons why it could, but a high carbs and high sugar, is causing like a up and down roller coaster in your blood sugar. If your blood sugar is not balanced, that itself depletes all your neurotransmitters. When your blood sugar is low, that triggers the fight or flight chemistry, which is adrenaline, cortisol, and all of that runs down your neurotransmitters. So a lot of mental health symptoms can be rectified. Again, it's not a rule across the board, it's very individualized, but regardless, you should feel a significant benefit if you make sure that your blood sugar is stable. And for that, it's important to have protein, 20 grams of protein every 4 hours. It's hard to do that. I tell all my clients that, like, yeah, yeah. And I know no one's going to do it, but let's say you don't do, protein every 4 hours, but you do it every 6 hours, you do a little bit less, there still could be a very significant um, benefit. And a lot of people who are doing what's it called, intermittent fasting, and they get benefits from it, but it's actually there are health benefits, but on a blood sugar level, it can actually cause mental health problems because your blood sugar is dropping, and then you have a lot of other neurotransmitter issues because you're depleting your neurotransmitters through not taking care of your blood sugar. So that's another thing to keep in mind. If you're having any issues and you're doing intermittent fasting, you may get a lot of relief if you just stop the intermittent fasting. That's something else to keep in mind.
I want to also add in that, you're talking about low blood sugar, but the way that there's people can get low blood sugar, one big way is when people are eating sugar and they're
Yeah.
and they're getting this spike. So they're raising the blood sugar is going up high and then it's crashing down low. So
Yes.
to stay away from sugar, like that might be like counterintuitive, but staying away from sugar and juices and even the natural forms of sugar, um, and focusing on the protein and the fat is a way to maintain
Yeah.
a
Yeah.
steady level and not have crashes. And there's some people that are particularly sensitive to this. So I know someone that was having a lot of anxiety, and then a knowledgeable person like started like copying the pattern. The person noticing that this person is very anxious, particularly in the mornings, and realized this person is particularly sensitive to the blood sugar highs and lows, and counseled this anxious person to really stay away from sugar. Like the person thought they were eating healthy and they really weren't having a lot of sugar to begin with, but it was pointed out to them that they really have to stay away from sugar, period. Like not even put any sugar in their coffee.
Yeah. I mean, I know for myself, like I cannot, if I go near sugar, I don't function the same. It's really, and I mean, I'd rather enjoy life than be very healthy. I mean, I want to be healthy too, but no, the sugar is like, I see it's immediate. It's as soon as I take the sugar, like my mind is less clear. And I just feel way better when I'm off sugar. So sugar is really poisonous. White sugar, some fruit, it could be better, but white sugar is really bad.
I'm reading this book, and it's by Shard. I was actually okay. It's not so showing up so good because it's maybe because of the Zoom background and
Right.
the
Yeah. If you move it back, I could see it more. Because if I think,
okay.
yeah, further back.
It's called Brain Energy, and it's by Dr. Christopher Palmer, MD. He's a psychiatrist. He's a Harvard professor, and it's really 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 interesting. And what you said about sugar that like brought it in. But there are stories here with people who had very serious mental health conditions. I mean, we're talking about they were on multiple medications for many years. Bipolar, and the medications aren't working, and they're like not functioning, and people who had attempted suicide. Anyway, people got completely better off of their medications and completely better. Stories that he wrote here, and a ketogenic diet and exercise were very, very, very key things. Of course, I'm not saying that anyone should try getting off of medications on their own. I'm saying he helped them to get off of it. He's a doctor, but it just the miraculous stories were really, really, really amazing, and it just underlines the whole thing that we were talking about, that the mental health issues are like, I don't know what the percentage, but I guess almost completely like, physical, like biological in nature. It's about whole body health. And we're going to talk more about that, you know, of course,
Thank
after.
you. Can you send me that afterwards? That book looks fascinating. If you could send me the link to it when we're done, I want to check it out.
Yes, yes. Let me say it. I know some people will be listening to the audio recording, so I'll say it again. It's called Brain Energy, and it's by Dr. Christopher M. Palmer, MD, Assistant Professor of Psychiatry, Harvard Medical School. Brain Energy. And what he talks about here is, the subtitle is A Revolutionary Breakthrough in Understanding Mental Health and Improving Treatment for Anxiety, Depression, OCD, PTSD, and more. But he goes into, the more serious mental health disorders in detail. And what he does is he ties every single mental health disorder, including Alzheimer's and autism, everything together with one unifying theory that he says that it is all coming from, they're all metabolic disorders, meaning how the cell processes energy. Hope I said that correctly. And they're all mitochondrial. It's like a problem in how the mitochondria, the energy center of the cells, are functioning. So basically, it's what we're saying: get people healthier, like fix whatever the root causes of their underlying health issues are, and their mental health will get better. So it's and actually, and he talks and he shows how people with mental health disorders very often have physical health disorders too that go along with them. It's like, they say all Alzheimer's is diabetes of the brain. You've probably heard that. So this is the same thing for across the board with all different mental health issues. Yeah, it's very, very interesting.
Sounds fascinating. I would love, yeah, I want to read it. Thanks.
I got it on Amazon. If you just look up on Amazon brain energy, you should find it.
Okay, so we're talking about the benefits versus the cons.
Yeah.
So yeah, another benefit. Okay, so it's immediate. That's it works the first dose. You feel the effects immediately. You get, we may have to adjust the dose. Sometimes you need a little bit higher, sometimes you need a little bit lower, but the benefit is immediately. They're not addictive. You can, for many people, not everybody, and it depends on the situation, you can also get off of it and maintain the benefit. Another very big benefit is that it really has such a wide range of applications because unlike medication, somebody's on SRI, you don't get on today and get off tomorrow, right? You get on it when you really need it. Whereas amino acids,
very, very, very hard to get off of that.
Yeah, there's so much, that's amino acid therapy. We said that before, it can be really helpful with the withdrawal symptoms and replacing the benefit that the person got from the SSRI. But it's very helpful for getting off of an SSRI because the drop in the serotonin is gotten out of the way because you're taking the amino acid, which replaces that. But specifically for amino acids, because they work immediately, they have such a wide range of application. It could be somebody who doesn't necessarily need medication, but let's say you have social anxiety, or you're just going through like a really tough couple of weeks. You don't want to go on a med for that, but you can take amino acids and you immediately get the benefit. And I know people will take it before they go to a meeting or they're going to a social event, and they'll take their amino acids. They make, it depends which one. Some people, they'll take endorphin ones, they'll feel more connected, and they'll take for the ones that, for anxiety. And it can be very, very helpful for kids and adults who don't necessarily need medication because they're fine overall, but they need it sometimes. And because they're effective immediately and they're healthy, it's a very good option for that. The cons, I don't think there's many cons. The one con that I would say is that I don't think some of them are not as powerful as the medications. So for example, the ones that raise dopamine, the group of neurotransmitters called catecholamines, they raise dopamines. They're sort of the counterpart to stimulants for ADHD, Adderall and things like that. So they're very effective and they're very helpful. But my client, I mean, the research didn't necessarily indicate it, but what I see from my clients is that they like it a lot, but they say it's not Adderall. It's not the same as Adderall. So if somebody really loves Adderall and it gives them that really intense focus, they're not going to get, for the most part, I've heard this from a few clients, it's not the same thing. It's good, but it's not the same level. On the other hand, that con is not so much of a con also because it doesn't have the downsides. A lot of times that intense burst of focus and productivity is the reason for the crash. It's very common when someone is on stimulants for ADHD, they're on it, they're doing either it's a short acting one and they have a couple of hours, or the long acting, but then when it leaves their system, they feel terrible. They're moody, they can't focus at all. The amino acids are smooth. It's raising it in a gentler but very noticeable way. And there's no crash for the most part. Again, anything is possible for anybody, but for the most part, they're a much gentler effect, and they don't have that negative side effect. I would say that's the overall pros and cons.
So it's an all natural product. Is that what I understand?
It's very natural. It's so natural. It's doing what the brain naturally does. We make neurotransmitters from amino acids, and we're just helping along using amino acids in supplement form. But that is the only way the brain can produce neurotransmitters. I'll just give one as an example. So let's say serotonin. The way the brain creates serotonin is from tryptophan. Tryptophan is an amino acid. So tryptophan is found in protein. And when you take a protein, the brain converts tryptophan into what's called 5-HTP. 5-HTP is converted into serotonin, and serotonin is converted into melatonin. That is the way it works. That's a fact. Amino acid therapy is just is giving you a supplement to help with the natural process and chemical process the brain anyways does. So it's I would say the most natural, it's not like some supplements are healthy, but it's like we're introducing something that's not necessarily in the brain's process. Here, this is the way the brain processes it and has to process it. We're just helping it by giving you in supplement form much higher, more potent doses so that you can resolve things.
Wow, wow. You mentioned Adderall, so I just want to just give anyone who might be thinking of using it or using it a note of caution because it can have really, sometimes terrible unwanted effects. So I recently, heard of a case with someone that went into psychosis from it, and this is still an ongoing story, unfortunately. And really destroyed a family. So
Yeah.
yeah. Is it expensive?
They're extremely inexpensive. It's crazy how inexpensive they are. That's part of the reason why I think there is research and there's studies showing the efficacy of amino acid therapy, comparing it to SSRIs and to other medications, but there's not enough studies. We need more. And there's nobody funding it because they're so inexpensive and pharmaceutical companies are not making any money off of it. It's a natural substance. So yeah, it's very inexpensive. I mean, most of them can be between $10 and $20 per bottle. Um, there's one of the ones that are for endorphins are a little bit more expensive. Even that, it's about, I think it's like $30 for 60 capsules. So they're very inexpensive. It really depends what the person needs. Some of them can be even less than $10. So they're very, very cost effective. That's another advantage, I should say. The whole treatment is extremely accessible, even if, people are not able to afford therapy because the amino acids themselves are very inexpensive, and you also don't need ongoing support. So my process is you have a 1 hour consultation. And I think I don't know about other amino acid practitioners, but I'm assuming it's the same. There's no reason for it to be prolonged. It's a 1 hour consultation where you will go through all the symptoms and your history. It's a clinical assessment. And in that one, we develop your protocol based on all the symptoms that indicates what's going on from a neurotransmitter perspective. And then you maybe need 2 to 3 follow-ups to change the doses. Also, we only implement one at a time because if we start 4 at a time, we don't know what's working and what's not, and we can't really tweak the dosage. So we start one at a time. So at the end of the first consultation, you're going to start your first amino acid. Then the next week, you're going to start your next, and the next week, your next. Now, if all you need is one, most people need a few different amino acids. If all you need is one, so then you may only need one. But that itself makes it extremely accessible financially because, a couple $100 and that's it, and you're done. So it's a very effective and it's very economical too for people to access.
Wow, wow. So, do you, I remember you told me an interesting story, about the OCD. Can you share that? The story that you told me?
Which one?
Lisa?
Oh yeah, yes. Yes, I'm going to share it, but I really want to I'll say the story. Baruch Hashem, there's a lot of these stories, but I want to I'm very excited about this, but I don't think this is my personal view in general. I don't think there's any one thing that's a miracle cure for everybody. So I want to just say that beforehand because I don't want people to be disappointed or think that this is the solution. I think it is the solution for a lot of people, but it's not going to be for everybody. So I mentioned the one with the guy with the marriage. There's another one. This happened recently also. A guy who he had a lot of OCD around Pesach stuff, and he went on the amino acids for something else actually. And he came back after Pesach and he told me his wife wants to call me because this is the first time that she enjoyed Pesach in 17 years because he was just totally calm and relaxed and not bothered by any of the chumras or anything like that. So yeah, there's Baruch Hashem, there's a lot of these stories, but it doesn't work for everybody. I had a few people that it was not effective for. So I did, the statistics show, and in my experience, about 80% of people will get a very significant benefit from amino acid therapy. But the 20%, there's a lot of other things that are helpful. So, hopefully we'll do, you mentioned beginning models that I use, but there's many other models too, and maybe we'll do some other ones on other things that can be helpful besides amino acid therapy. But yes, it's Baruch Hashem been amazing. My clients I had another client this week who is ending therapy because he started therapy, we made a lot of progress, and he needed some more. We did amino acid therapy. Now he's doing great, and he doesn't need therapy anymore. So it's really Baruch Hashem been very helpful for a lot of people.
Baruch Hashem. It's so amazing, and it's something to really respect, that you're not looking to keep people in, even though it's your parnasa, you're not looking to keep people in therapy. You're looking
Yeah.
to
I'm
help
not, I'm
them
not
get better.
like if they're good, what are we doing here? Like I don't want to just talk and talk about nothing. It's
I
like
mean, the amino acid therapy is so cheap. It's not
right.
something going to keep people as your paid clients, and but your goal is to help people feel better. So
Baruch Hashem, yeah.
hope
Yeah.
here that that it's not a real moneymaker. So that's what can people, how can they reach you if they would like to see if this can be something for them?
So there's more information about amino acid therapy on my website, um, about amino acid therapy and all the other models that I use. I see people remote, so I could do this remotely. I only work with adults. I mean, I can work with kids with amino acid therapy, but not with, I don't do therapy with kids, at least at this time. But amino acid therapy could be for adults or kids. And I could do it remotely. You can reach me. My website has information, chaimmoshe.com. If you have questions about it, you can email me. I don't have time. I've been getting a lot of calls about it. I just don't have the time for a lot of conversations about it. But you can email me questions before you book. It's chaimmoshe@chaimmoshesteinmetz.com. Maybe I'll put that in the chat if people need. Um, and you can
So
book
your
directly.
website, yeah, sorry, your web, I'm saying it over because it's going to be on the audio, so we have to say it
Oh,
like very slowly and clearly so
okay,
people can
yes.
hear.
Chaim Moshe, Moshe. It's Chaim Moshe, but on the website, yeah, Chaim Moshe Steinmetz.com.
Spell Steinmetz.
Steinmetz.
Okay, so Chaim Moshe, there's two M's
Steinmetz.
in there. Yeah,
Exactly.
Chaim
Chaim and then Moshe.
Steinmetz.com. That's the website. And the
And
email
then
is like the same thing, like double. Chaim Moshe
add
at
Chaim Moshe Steinmetz. Yeah.
Steinmetz.com. So on the website, there's more information, you're saying?
Not more than what I
And
said now. It's just a page. Not more
oh,
than I
it's just
said now. More than just the words amino acid therapy. But what we covered today was a lot more in depth than it's on my website. Yeah.
okay. And to reach out to you, it's your email address, Chaim Moshe at chaimmoshe.com.
Yes, I'm putting that in the chat now as well.
So people
Um,
should not try this on their own.
um, so they shouldn't, not from today's conversation. No, I would say not. I mean, there's certain ones that, you could just try and they could be helpful, but it's not targeted. Now, if somebody is struggling, they would be best served to do this professionally.
So you evaluate a person based on their symptoms. You figure out what neurotransmitters they're low in, and
Right.
then based on that, you give recommendations to them what neurotransmitters to try, and you tweak it based on their responses.
Exactly. Yes, exactly. Yeah. It's very, very individualized because there's some people that, especially someone sensitive to supplements, they can take their finger, lick it, dip it, like open a capsule and touch the powder, and they'll get the benefit for the whole day that way.
Oh my
And
goodness.
there are other people that will need, I mean, I'm just thinking of the specific dosages. Let's say there's one of the one that I mentioned is a 50 milligram capsule, right? You dip your finger into it. So what are you getting? 20 milligrams? And that will do it for the whole day. And then there are people that only 500 milligrams of the same
Wow.
thing. So there's a lot of customization that's necessary because if you're taking the ones that you don't need, you're not going to get a benefit. If you take too much, you're not going to feel great because you don't need that. Your body doesn't need that much. So it's very
Right.
much individualized. And it really depends also on getting the correct amino acids. Amino acids is not one pill. There's 10 that we use, maybe nine or 10 that are used depending on what's going on.
Wow, wow. So they really would benefit tremendously from contacting you. How will you figure out, like, if someone needs the teeny dose or the huge dose?
Right. So if somebody has a history of being sensitive to medications or supplements, then I will always start them on a finger lick.
Mhm.
That's just the rule of thumb because there's no way to know 100% advance, but it's a good indicator. Like if somebody's like, oh, every medication I have side effects from, or every supplement that I've taken has caused ABC, then I know that that person's nervous system is sensitive, and then they're going to start at a much smaller dose. Now, if somebody is not sensitive, so then each amino acid has what we call a trialing dose. They're starting at the lowest level, and we adjust it. That's if the person, the next time they follow up, we're going to tweak it based on the response to that dose. And there's a very wide range of doses that can be, depending on the person. But there's a very, very wide range.
Wow, wow. Thank you so much. I want to also mention that your consultation is not very expensive either.
Right. It's 255 for the initial consultation, and follow-ups are 120 because they're just a brief check-in, 20-minute check-in to up and change the dose or implement the next amino acid. And again, for most people, it really depends on how many amino acids the person needs. Um, if all they need is one, so then they may be able to just do one with a follow-up. If you need three or four, so they'll probably need a total of the 3 to 4 um, sessions, the first plus the follow-ups. So it's a couple $100 investment altogether.
Wow, wow. Yeah, Shukaya, Hashem should help. This should really help a lot of people.
Amen. Thank you.
Are there any questions? Let's see. Um, can you
Oh,
see?
we didn't mention the contraindications. So we mentioned, let's just say that very briefly, there are some contraindications. Psychosis, schizophrenia, mania, those are not for a lot. Some of the amino acids we could take, but not some of them not. Um, certain types of cancers, kidney or liver disease, uncontrolled high blood pressure could be problematic. Those are the main contraindications. Now, SSRIs, I should mention this as well. SSRIs, you could do most of the amino acids. One of them, the ones that raise serotonin, you can't do it for, you could, but you can't do it for the long term because if you have too much serotonin, that can itself cause symptoms. So you could trial all of even the serotonin related amino acids while you're on an SSRI just to see how your body responds to it, but you cannot take it for the long term because there's a risk of serotonin syndrome, which means serotonin is raised too much. Um, but it's very helpful for information to see how you respond to it because maybe you don't need if you respond well to it, so then together working with your doctor, we can help you get off of the SSRI if the amino acid is what's appropriate for you based on the trial. That's yeah.
Um, so I see there were a couple of questions. I see someone asked which amino acids, like for which thing, but I think you didn't want to say that because it's not the
I mean,
best.
I could say very generally, but I do want to caution that you should not try it unless you really know, you make sure that it's okay with your personal history, your medical conditions, your medication, and also maybe do some research on dosages and all that. I don't recommend it, but in general, for serotonin, the ones that are commonly used are either tryptophan or 5-HTP, and each one has its pros and cons depending on the person, which ones are used. Then there's low blood sugar. We want to stabilize that with food optimally, but that can also be done with L-glutamine. Again, that has some cons. So I'm just giving this for information purpose, but I really don't recommend that people try to figure this out themselves because there are some risks and you don't want to run into those without being aware of all the ramifications. Um, then there's endorphins. So for endorphins, there's either DLPA or D-phenylalanine. Then there's GABA. We use a few different ones for GABA. Taurine. Then there's the amino acid itself, GABA. There's L-theanine. There's some other supplements that we'll also use with GABA. So magnesium can be helpful, but the amino acids are GABA, taurine, and L-theanine. And then for the catecholamines, which is dopamine, epinephrine, and norepinephrine, we use tyrosine. Sometimes fish oil, although it's not an amino acid, but it's very helpful for overall brain health, and also specifically for the catecholamines.
Mm, well, and then someone asked if there is any blood test to see what neurotransmitters a person is low in.
Yes, so there are a few tests that test for neurotransmitter, I'm sorry, for amino acid levels. We're testing, right, if you're depleted or not. So we don't use that for a few reasons. Number one, it's expensive and it's also unnecessary because the best picture that we can get is actually from a clinical assessment. The blood tests can show what's going on in the moment, but they don't show what's going on historically. And there's many reasons why those can be the testing can be inaccurate. Like for example, I don't know if I told to you or Mrs. Brock that if somebody, let's say, has anxiety about getting their blood taken, they're going to have high GABA levels because GABA is a chemical the brain releases to calm. Because you're anxious, the brain's releasing calming neurotransmitters. That doesn't mean that your neurotransmitters are adequate. It just means that in your blood right now you have high GABA because you're anxious right now. But it could be you're actually very low in GABA. Your reserves can be very low, but in the blood in the moment, you're having high levels because right now you have anxiety. So it's not necessarily the most accurate way of testing. It's also much more tedious because you got to get a lab and it's unnecessary. Like psychiatry, most psychiatrists are not doing testing. They're going off SSRIs are prescribed based on the specific symptoms. The best indicator of the neurotransmitter issue is the specific symptoms. Each neurotransmitter is responsible for specific roles in the brain. And based on the specific symptoms, we have a much clearer picture than I shouldn't say clear. It's more thorough and it could be clear depending on which specific neurotransmitters are the issue.
Mm. Mr. Steinmetz, someone raised her hand. Are you comfortable taking a verbal question, or do you want to ask her to type it?
No, they can ask the question.
Okay. iPhone Leia, do you want to unmute?
Okay, I'm unmuted. Yeah, my chat is disabled for some reason, so I couldn't ask a question through the chat. So my question is, what about honey as a sugar? Would that be okay, limited quantities?
So I'm not an expert in these things. I think Ms. Weisberger would know better than me. I do think it's better, but I don't think it's great. But I'm going to defer to Mrs. Weisberger on that.
Okay, thank you.
Okay, so my friend Esther Black in Eretz Yisrael, she is a holistic health consultant and a researcher. So she says that the only sweetener that is healthy and should be used is raw honey, and it's a little bit hard to get raw honey and make sure that it really truly is raw. But I'm not. I can't tell you for sure that it doesn't raise blood sugar levels. And that it's not. I think that I think it still does. I don't know. I'm not.
I think it does. Yeah.
Yeah. So anything that's going to raise blood sugar levels is I guess going to lead to them cooling down afterwards. There must be something better about it. About the raw honey. I know that she mentioned to me a person who suffers from gout, and the raw honey, any other sweetener causes the person to have a gout attack, and the raw honey does not. So there's definitely something different about it, much healthier about it. It's definitely a much healthier food, but I'm not going to say that it doesn't raise blood sugar levels. So I don't know. Maybe you can try it in
I do try it. Yeah, that's the only sugar I eat. So I just wondered what his opinion was, or anybody's opinion was.
Well, one thing I could say is that anytime you're taking sugar, if you take it along with fat and protein, you're mitigating the negative effects because
fiber.
Sorry?
And fiber.
Yeah, and fiber, because the spike is the problem. It shoots up and then it drops because the insulin comes in. So if you're going to take even if you take real white sugar, like straight, like a spoonful of white sugar, if you take that with some fiber and let's say a piece of chicken, the effects are going to be much less problematic because the speed that which it triggers the spike is going to be it's not going to be as fast. So it's not going to have the roller coaster effect to the same degree. It's still not good. It's still not healthy, but you're not going to have the same negative effect as you would if you took it, by itself or without protein, fat, and fiber.
Got it. Okay, thank you.
And you, Mr. Steinmetz, you reminded me about another issue with the refined sweeteners, is that they're depleting people's nutritional reserves, like their B vitamins, when they are, being consumed in that form. Then I think it's using up the B vitamins. They don't come with any nutrition, and they're using up the nutrition in your body in order to process them. So you're
Yeah.
just making the situation much worse. And so many people that have, some kind of illness that they're trying to get better from, a huge part of the problem, and I'm going to say some stories about this afterwards, a huge part of the problem is that they are so nutritionally depleted.
Yeah.
And they don't even, yeah. Okay, thank you, Leah, for that question. Okay, thank you so much, Mr. Steinmetz. This has been extremely, extremely informative. And I really appreciate it. Hashem should help that it should really bring a Yeshua and a refuah to a lot of people.
Amen. Thank you.
Okay. Okay.